Professora Claudia.
Good morning, good evening, good afternoon, everyone. My name is Claudia Bauzer Medeiros. I'm the co-coordinator of the program in eScience and Data Science at FAPESP. Eduardo.
Hello, good morning, good afternoon, good night to everyone. My name is Eduardo Marques, professor at the Political Science Department at USP and one of the coordinators of this project.
And would like to welcome you to our webinar on data science for social good. And to open the webinar, I have the pleasure of introducing Dr. Luiz Mello, who's FAPESP Scientific Director. Professor Mello.
So again, good morning, good afternoon, good night to you all listening to us in this event. It's a great pleasure to open this webinar, another webinar, but this one is particularly relevant given the wealth of data in which we live and the availability of making science in many different ways than we formerly did. There are a number of aspects which are relevant for this, which will be addressed on this event, but there are other aspects which may be only marginally addressed on this event, which are on the psychological nature of human beings, on how possessive people are. The concept of property here on data which has been generated with public funds should of course be discussed in a way that this is really made publicly available. So to have this conversation, we have a distinguished panel of guests, and I now pass the word back to Claudia and Eduardo for they to conduct this event, and I wish you all a great event.
Thank you very much. And before we start, I'd like to ask all of you to email your questions to eScience@fapesp.br, and they will be answered either during or afterwards by the panelists. Also, before we start, I and Eduardo Marques would like to pre-announce many new events and activities concerning social sciences and humanities and their use and their collaboration with data scientists for advancing research and knowledge. And you'll be hearing about this through FAPESP announcements. Eduardo, I don't know if you want to add anything.
No, just to say that FAPESP acknowledges the great importance of data science and eScience for research in general, but especially for the social sciences, considering the amount of data that Brazil produces and not only the availability, but also the quality of the data we have in Brazil. So we have been discussing activities and programs that could help to make the use of these tools, data, analysis more frequent, using data from the social sciences, and also producing a stronger dialogue between researches and theories produced up to this point by the social sciences with uses of data science produced by data scientists. And so in this spirit, FAPESP is going to announce a series of activities and through next year, and I think this is quite good and quite good news for the social science.
Okay, thank you. And without further ado, I'd like to introduce our first speaker. We have changed the order. The first speaker will be Irina Kuchma, and unfortunately, she'll have to leave after her presentation. So if you have any questions for her, please start sending them. She'll answer a few before departing. She's had an emergency that she cannot escape. So Irina, please, the podium is yours, and thank you very much for coming all the way from the Ukraine and Switzerland at the same time to this event.
Thank you so much, Claudia. And please do email your questions and I'll answer them in writing after this meeting. Thanks a lot for inviting me to talk today. It's a very good week and really hot off the press. It's UNESCO Open Science recommendation that has been adopted by governments earlier this week, and it sets an international framework for open science developments, and it's the first international instrument of its kind. And when this recommendation was provisionally discussed with representatives of member states, Brazilian delegation was very active, and I would like to thank Brazilian colleagues for pushing forward this open science agenda. I would like to.
I'm sorry, Irina, I have to interrupt you because I forgot to say that you were one of the 3 experts invited by UNESCO to help draft these recommendations way back 3 years ago, correct?
We actually did that this year and last year, and
okay.
Also I was one of the 3 international experts, but there were also colleagues from the countries. So yes, UNESCO Open Science Advisory Group was a large group, and it was a pleasure to work with colleagues. And of course, the context in which Open Science recommendation was adopted is a context where we managed to get tests and vaccines from COVID with unprecedented speed. So we could already see how open science played a role in finding solutions for this pandemic, and it would be excellent if open science could also solve other challenges we're facing, such as climate change, for example. And the context in which UNESCO introduces this open science recommendation is to make sure that no one is left behind with regard to access to science and also benefits from scientific progress, and ensuring that researchers all over the world, and not only in well-resourced institutions in the global north, could have access to data, methods, processes, and use them in accordance with the rights and obligations, including exceptions and flexibilities to copyright under international agreements. There is also a general understanding that data access, sharing, use, reuse helps to get scientific results faster and helps to reduce duplications of efforts and costs in collecting, creating, transferring, reusing data, but also scientific material allowing new research, more research from data collected before, and also increasing social impact of science and multiplying opportunities for researchers from all over the world. This is how open research data are defined in UNESCO recommendation, and an expectation is that open research data are available in a timely and user-friendly, human and machine-readable and actionable format in accordance with good practices for data stewardship, such as CARE principle for indigenous data governance, and also FAIR principles, which stands for findable, accessible, interoperable, and reusable. It's actually for the first time when open science recommendation addresses this issue of indigenous data, indigenous knowledge, and involvement of other societal actors, not only researchers, in research process. And of course, all that should happen according to principles of responsible data management and ethical data management and governance. And recommendation follows the principle as open as possible, as closed as necessary. So if for some reasons data can't be made immediately open, the request is that data could still be shared under specific provisions, or maybe made open later on after certain embargo period. And the recommendation introduces a number of actions. So one of them, promoting a common understanding of open science and also supporting diverse paths to open science. And we've seen, unfortunately, some cases when data has been irresponsibly extracted from the knowledge producers in the global south and exploited by commercial companies in the global north. And UNESCO recommendation specifically addresses those cases. So it specifically stresses that if data is used, then the benefits of open science and data derived from the data should really be shared with all producers of data. And those inequitable extraction of data and knowledge cases should be prevented. And it shouldn't be the case that those who have more advanced technologies could profit more from the data. So it sets an equal playing field for producers, collectors, users, reusers of data. It also stresses the importance of research community and community agreements on the discipline level, on the national level, regional, and other levels, on the approaches to data sharing, formats, standards for describing data, tools, and infrastructures. And it stresses the importance of interoperable data that could be reused by researchers from other domains, because that's what we see more and more nowadays, and encourages to share data in a way that it could be reused for interdisciplinary research. It stresses the importance of investing in human resources, training, education to build skills for open science. Because unfortunately, such skills are still lacking in many institutions in our countries, and encourages governments and institutions invest more into data science and data stewardship, skills building, curation, long-term preservation, archiving of data, and agreeing on a common framework of open science and data science skills and competencies aligned with specific disciplines catered for different career stages researchers, and then based on that core set of skills and competencies come up with training programs to strengthen those skills. And some examples of skills and competencies could also include intellectual property law, skills needed to ensure open access to data, engagement with societal actors, and all other skills. And then the recommendation also calls to professionalize data science and data stewardship as a new profession. And some institutions and countries are already doing that. And the idea is that this could be done on the international level, national level, institutional level. So such new professions could really emerge and provide very much needed support to researchers and also civil societies and other actors who are involved in data collection and sharing. And then we all know, we in academic environment will know that we could have beautiful open science policies, but if researchers keep being evaluated the way they are evaluated now based on publications in journals with high impact factors, we wouldn't really go far. And this recommendation also calls countries and institutions revise their research assessment and promotion and evaluation incentives and structures, and really value all relevant research activities and scientific outputs, including high quality, fair data and metadata, and encourage funders, institutions, publishers, loan societies, adopt policies that really require and reward open access to scientific knowledge, including data sharing, and open software, open code, open hardware. It also calls to share all research results, not only research results that produce expected results. So there is an encouragement to share negative scientific results, those results that do not conform to the results expected by researchers, and data, of course, associated with them, because that could also contribute to advancement of knowledge and stop others from repeating something that has been already proven wrong. And develop strategies that facilitate deposit of data in repositories and archives to promote their curation, preservation, and make them usable and reusable over time. And since we're talking about use and reuse of data, I would like to show some examples that we collected in the context of Open Air project, which was a European project to help researchers practice responsible research data management, among many other activities. And when we're talking to researchers about data sharing, many of them were saying, why should I be spending all this time to prepare my data to be shared if none in the end would use it? I don't believe anyone else would need my data. I think I need it. It was useful for me, but not to other researchers. So to answer to these arguments, we started collecting examples of data reuse from different disciplines. And we have this collection. And if you have an example of your data reuse, please let us know, and we'll be happy to add you as a use case to this collection. And one of them is an experience from Edinburgh Research Data Repository in the UK. And here is a professor who works in the School of Geosciences. And in this video, he talks what kind of impact public data sharing had on his research, because it really it saved time for him when he was building climate mapping databases and doing his climate mapping research, when he was reusing others' data, and he was happy when his data was also reused. Another example is from School of Philosophy, Psychology and Language Sciences, also from Edinburgh University. And this professor collected a significant body of audio data, song and stories from individuals living in South Sudan. And that was part of his linguistic research into local languages of Shilluk and Dinka. And it was really rewarding for him that he collected this data and interviews as a linguist, but not only researchers doing research in linguistics access this data for free, but also members of local communities in Sudan, because they could discover their lost heritage. And he was also pleasantly surprised when some of the songs that he collected were used by journalists making documentaries. So it was a very unexpected and very rewarding example of his data reuse. And the data was available in an institutional research data repository. And how this repository knows that data is really used. They track usage statistics and they see really high visits numbers and downloads numbers in this repository. And the university also gives rewards for data sharing. So they used to have an annual data sharing reward prize, and they identified a number of researchers who were sharing data and were very happy with the results of this data sharing. Another example is from Saudi Arabia, and KAUST is one of the flagship universities in Arabic world. And here you can see repository statistics and data sets, the most downloaded types of research outputs in this institutional repository. Then there are dissertations, and then there are research articles. So data sets are downloaded even more often than papers. Another example is from Binder, which is used by researchers who analyze data which is available on Zenodo. And when I was preparing my slides yesterday, there were 1,284 Zenodo data sets that were analyzed at the moment. And other researchers took those data and used them for their own research and analysis. My last example is from a research institute in Italy. And that's an interesting example how data about fish in the ocean was reused for other purposes. So one of them was creating aqua maps. So it was a data set that listed types of fish that lives in the ocean at a certain period of time. And then other researchers used it to create maps of aquaculture. And another researcher took the data and used it for climate modeling. Another example is data about floats, marine floats, which was collected by one research project and then standardized and analyzed by another completely unrelated research project for their purposes. And then a third project made it reusable in an open database. So it was also an unexpected collaboration among 3 environmental related projects. And not only data was reused but also approaches to analyze data. So for example, in one case, they used time series as an approach to analyze data. And this time series approach was also replicated by other researchers and was published as a journal article with appropriate credit to researchers who first tried this time series model. So there are really lots of benefits there and unexpected results from sharing data and reusing data. And thanks a lot for your attention. And I'll be happy to answer any questions you might have.
Thank you, Irina. Just pointing out that it's very timely to talk about the UNESCO recommendations because they were voted 2 weeks ago, right? And they are going to the General Assembly next year, right?
No, it's the General
It's already
Assembly.
effective.
Yeah, General Assembly already adopted them this week. So they were voted last week and formally adopted this week. So that's a great news and reason to celebrate.
Yeah, for sure. Now, Eduardo, are there any questions for Irina before she departs?
Yes, we have 4 questions. I don't know if you have time to answer all of them now, but I can email you or send you the written questions afterwards. The first one is, in which way data science and social scientists can contribute to open science? The second, maybe I can.
Yeah, maybe read them all.
The second one is how to increase and densify. They are related, actually. These first 2. How can we increase and densify the interdisciplinary dialogues between data science and non-data oriented fields? The third one is if data science can contribute to social good, there are constraints and restrictions. The so-called responsible data science involving data ethics. Could you please elaborate a little bit on this? And the fourth one, maybe this is too much.
No, maybe read the first one as well.
I'm sorry to interrupt. Maybe Irina could just give an overview of these 3 questions, and then we'll continue with our program. Okay, is that okay?
Okay, and then I send you the fourth the fourth question, and you can answer in writing.
Thanks a lot, sir. And I think they're all great questions and very important and like very large questions. And I hope other panelists will also address them in their talks, because that's a topic of today's webinar. And I think social scientists should make sure that their data is archived in appropriate data repositories for future generations of researchers, because we don't know what kind of future uses this data might have. And if possible, if there is no personal information involved, then the data could be shared, or data could be shared as pseudo anonymized data without personal information, and made available to other researchers. And what's also important is FAIR part, which I mentioned, where data is really well described and shared with reuser perspective in mind, in a structure that other researchers would understand, clearly labeled file names, maybe README files next to data sets explaining how data was collected, analyzed, providing some context in which this data was used, and perhaps could be reused as well. So it's well described, well documented data. And if disciplinary standards are followed to describe the data, but also some generic standards for describing data that researchers who are not social scientists might also understand. And usually data repositories take care of that. So you as a researcher don't really need to worry much, because those tools will be provided by repositories. But some effort will be needed on your side to properly label and describe that. And about collaborations with non-data scientists, that's a big question, and it depends with whom you are collaborating. But it's really important to credit people, like credit communities with whom, for example, you collected data, and also share research results with them as a minimum. And I hope other panelists will also address these questions, and thanks a lot for them.
Thank you, Irina. And I realize you have to leave, so have a safe trip back to Ukraine. Okay. And thank you so much for coming. And I'm sorry, really sorry you cannot stay to the end, because we were all looking forward to the full discussion of the panelists.
Yeah, I'm also very sorry about that, and thank you so much.
And I'll definitely send you and put you in contact with the person. Okay.
So now I'd like to introduce Lorena Barberia. I hope you pronounced your name right, from USP, who'll talk about the impact of data collection and accuracy on the evaluation of COVID-19 mitigation policies in Brazil. Welcome, Lorena, and thank you very much for coming all the way from across the street, from São Paulo to this webinar.
Thank you very much, Claudia. It's an honor to be here, and it's an honor to be a part of this event. I hope everybody can see my slides. Yes?
Yes.
Okay, wonderful. So I think a little bit of, in preparing my comments today and in trying to bring together the presentation, what I'm going to try to illustrate is, and it's actually very well timed, that a lot of what Irina was speaking about in terms of principles and the types of norms we want to follow in thinking about how we can use data to improve responses to a major challenge, such as in the case as I'm going to be talking about the emergency we face with COVID-19 in the case of Brazil. I'm going to try to show how that works in practice and how we're operationalizing in practice the use of data to evaluate the response to COVID in Brazil. And I'm going to be speaking primarily about two initiatives to which I belong to. One is the Solidarity Research Network in Public Policy and Society, which is a research network that was formed at the beginning of the pandemic to help shape and monitor public policy responses and evaluate them across the Brazilian Federation. And I'm also going to be talking about some of the work that we've undertaken in collaboration with Observatorio Covid-19 BR, which is also another initiative that has done a lot of inroads and made a lot of inroads in thinking about how to bring together multidisciplinary teams to think collectively together about how we can mobilize data and how we can use data to infer and understand where we are and where we stand in this moment in Brazil in terms of the risk and the containment of COVID at different moments. So just basically, just to start off and to underscore, it's incredibly important for us to be directing efforts and to try to be mobilizing across multiple areas of understanding the social sciences, which is where I come from as a political scientist. We are trying, and it's very critical to us to be thinking about how do we contain and help to reduce the impact which has been so severe of COVID in countries such as Brazil. And here, just to underscore, we know that Brazil is the second highest death toll in the world. And as we can see, kind of 2021 was a year in which the pandemic accelerated and worsened. And we need to understand what happened in 2020 and how 2021 we could respond differently. And we need to be thinking right now about 2022 and what types of lessons we have from the data we're assessing can help avert further losses of life, infections, health consequences for those who are infected, etc. So part of what my work is as a political scientist and someone who is interested in public policy evaluations, we're fundamentally interested in understanding during COVID-19, what is the effect beyond going at the effect of just looking at the outcome, the health outcome, so looking at infections or looking at deaths. Ultimately, what we've argued and what we've tried to help promote is an understanding that in order for us to know what's working and what's not working, we need to integrate and think about government policies. We need to think about and monitor citizen behavior and use both of those metrics to then evaluate health outcomes. And without proper measurement and monitoring of policy and citizen behavior, we really have a lot of uncertainty about the inferences we can make about health outcomes. So the work that we undertake and the work that we're trying to contribute in the Solidarity Research Network, in Observatorio COVID-19, those are examples of initiatives in which we're trying to help to mobilize data to use to help to clarify the picture and understand better what's going on by monitoring a little bit the dynamics in this complex pathway that we're trying to advance as the pandemic progresses. But the issue is that at every stage of what we want to do, data collection and accuracy is fundamental. And I want to start by underscoring that in the case of COVID, it's critical for us to recognize that when this was a major emergency, and when the emergency began, and even to this day, in all aspects from government, there's tremendous challenges about accessing data and measuring trying to measure the phenomena. So if we think about government policy, or we think about citizen behavior, and we think about health outcomes, in every front, we have enormous challenges in actually being able to measure the phenomenon we want to measure, and being able to then use that data to assess and evaluate what's happening in real time. And so we've spent a lot of time working across disciplines. That means working with data scientists, working with epidemiologists, working with even people who work on many multiple fronts, dialoguing and also dialoguing with government officials, because we need to be working collectively together across disciplines to be thinking about the types of data we have access to, and how they might limit or how they can limit or improve our capacity to capture and understand and monitor what's happening on the ground during this health emergency. It's important to underscore that public data is not always available. In fact, most of the data that we've undertaken during the COVID-19 response is data that we've generated. So it's new data that we've produced. We've come up with new indicators and thought about creative ways to measure and capture different dimensions. And many times, official government data, we have to enter and request through kind of government transparency sites, request data that takes many times 2 to 3 months for that data to be sent, if it is in fact even sent, because many times we don't have a lot of transparency and we don't have access to the data we would like to have. So we have to be creative, because we don't always have the ideal data that we would like to have to evaluate what's going on. The other issue that we've tried to underscore a lot is thinking about that case definition, and that this is crucial, varies across times and across units. And that comes with respect to countries, and it also comes with respect to municipalities and states in Brazil. So we need to be thinking a lot about every time we think we have a measure of a specific type of observation. Okay, so for example, different systems register tests versus hospitalization versus vaccination. And this is a problem because we lack unified systems in order to be able to monitor what's going on. And it's also very difficult to measure citizen behavior. And I'm going to talk about that shortly with an example. But a further problem is we have to think about that in this moment, we're facing a major health emergency in which there's considerable time lags between when events are occurring and when they're being reported. So we have to be thinking about all of these things when we think about data accuracy and availability, is thinking about these fundamental challenges and how we can overcome them. So briefly, just to give examples, I'm going to give 3 examples of work we're undertaking to try to show how we're being creative about creating new types of data, and showing in addition how we're using it to assess policy. The first is assessing the effect of social distancing stringency on citizen behavior and public health outcomes during the pandemic. This is an example of work we've undertaken in collaboration with Oxford University and researchers across the world to monitor the stringency of social policies with respect to school closures, business closures, mask mandates. And the darker the color is showing a more stringent atmosphere in that specific state, a more specific response of mandating greater social distancing, mandating masks, mandating more stringent policies. And what we can see in 2020, we see the evolution, and that there's a really important change across time in how these policies were implemented. We've used, and in addition to monitoring that, the specific policy response, we've also used that to contrast with what we call isolation. So what are the % of households that are remaining at home, outcomes including deaths, and the job loss rate in the official job market in Brazil. And the reason I'm trying to underscore here this slide is to also show some of the challenges. In each of these areas, we lack considerable challenges in order to be using and accessing data real time in order to assess what's happening. We can think about social distancing policy stringency. That depends on assessing government decrees and official documents, which sometimes are vary considerably across states and across municipalities, and we have to create uniform criteria that allows us to compare them. When we think about isolation, the majority of inferences that have been made about COVID adherence to social distancing in the world are based on tracking cell phone movements outside the home. But we have to remember that we live in a country with a lot of heterogeneity, inequality, and poverty in Brazil. And so mostly what we're assessing when we look at, and we have studies that quantitatively assess the effect on adherence to social distancing, we're studying what we call the insiders, the people who have access to trackable cell phones, which is not the poor, necessarily the poor and the most vulnerable populations in different localities. With death rates, we have a lot of challenges because what is considered a COVID-19 death varies across time and varies across cases and depends on the registry. And the same thing with respect to the balance rate, because as I was explaining, this is the rate in which new jobs are being created and job losses are occurring. So it's the overall balance in the formal sector. And that, of course, varies considerably because what we understand is over 50% of the workforce in Brazil is in the informal sector. So in order to be using this type of data to assess, we have to be thinking about what each variable or each measure allows us to measure, but also acknowledge the groups and the types of problems that the data has limitations and the uncertainty around that data. This is just another example to kind of underscore that point where we're looking at the difference in the three lines. It's the hospitalization rate in Brazil, and the difference is when the symptoms occur, when the data is registered officially in the system, and when the case actually occurred. And you're noticing that the three lines don't overlap completely, although they follow a general pattern. And that's important to understand because in any of the data that we're using on COVID, we really have to think carefully about how the data is being measured and what are the limitations in terms of the inferences we can make depending on the metric we use and how we use that metric. A second example, really quickly, is with surveillance policies, in which we're looking at and trying to understand what's happening with the overall testing effort to detect COVID-19. We're looking at policies again, and this is in the case of São Paulo State, where the testing policy of who could be tested for an infection varied considerably across time. So in the beginning, we've focused on hospitalized cases. We moved to symptomatic cases. We expanded to also include clinical and epidemiological criteria to count a case. And in the fourth policy, we incorporated genomic surveillance as an additional guideline in order to enhance or increase the testing effort. And here what we're looking at is test capacity in the public health system versus overall testing effort. And so when we think about the overall outcome, which is in the next slide, that shows the outcome, which is we're looking at the number of tests that occurred over 100,000 inhabitants, and also the variation in the positivity rate across each regional health district in the state of São Paulo. What we can see is we can use then those testing policies are really important to think about how different policies might be producing different outcomes in terms of the testing effort. And we've spoken a lot about that to also think about social vulnerability. So this is a map of the same state and the same regional health districts in which we show where are the most vulnerable regions in the state. And so we can use what we're doing in our research is we're contrasting where there's greater social vulnerability and trying to assess if there's greater testing efforts in those more more vulnerable populations in the public health system. And this is just a final slide to underscore that we can also see that to think about surveillance. And here we're looking at genomic sequencing and thinking about if those more vulnerable communities are also being monitored equitably in terms of genomic sequencing efforts. Each of the different colors is a different RHD. And as I was showing you before, Registro, for example, is one of the poorest areas of the state. So we can see that kind of early on, there was very limited genomic surveillance in very poor parts of the states. And over time, we're understanding how test positivity rates are varying, but also understanding if the variance and the type of variation that we have in risks is changing, and if we have sufficient genomic surveillance occurring across different parts of the state. The last example is vaccines, and we're using Twitter and we're using social media. Why? To monitor what's going on, because social media has been fundamentally important to understand citizen behavior. And so here what we're looking at is over time, the total amount of tweets on vaccines that occurred in 2020. And we're tracking also events, which are the moments in which the president or there was a major political event, and also when there was a major clinical trial or outcome event related to vaccines. And we're using this to assess or try to understand why is the population interested in vaccines and what creates greater debates in social media around vaccines, and what is the content of those debates. This shows that the content of those debates is definitely motivated by the vaccines which Brazil is acquiring and which the contracts which Brazil was closing in 2020 and 2021. So this is the percentage of tweets by vaccine brand. And what you can see is there's a strong predominance of tweeting on CoronaVac and AstraZeneca, which are the two platforms. Over 70% of vaccines that were distributed in Brazil up to now are from those two vaccine types. You can see that those are predominant, but in the later weeks we start to see a greater tweet activity around Pfizer. And we've also looked at that in terms of political dimensions and political alignment. So when we look at favorable and unfavorable, or negative and positive messaging around vaccine tweets, we can also see that there's greater distributions of negative tweets associated with those who align with the president versus those who are not aligned with the president. And this is important in order to try to underscore that we're very, very worried about thinking about citizen behavior, and we need to be thinking about interest in vaccination and understanding the political and ideological dimensions of that. So I hope that this kind of brief presentation, these brief examples, it allows and gives an example of the flavor and the potential of how we can use data in an emergency to try to answer critical questions. This is an example of the team of researchers that are working in my group and in the Solidity Network to gather data and to assess policies. All of our data, we make an effort to make it available on GitHub so anyone can download and access the data, as well as replication codes of our analyses. We cover and we publish policy briefs, and there's also other links that I've added of the Observatorio and Fiocruz, where some of the data that I used also come from those sources. So thank you very much.
Thank you, Lorena, for a very instigating presentation in which you showed how context is important to analyze data and quality data, of course. And before I present our third speaker, I just would like to remind the audience to send us questions via email so that your questions will be discussed during the panel discussion, okay? So now I have the pleasure of calling Priyanka, all the way from Australia. It's almost midnight in Australia. So you can start talking to us tomorrow, right? It's tomorrow in Brazil. And Priyanka, thank you so much for your patience in waiting until midnight to talk to us. Everybody can look at the site of this webinar about the curricula and so on of the invited panelists.
Thank you so much, Claudia. And yes, it'll be tomorrow in 3 minutes. So I'm joining you from Melbourne, Australia. So I would first like to thank Claudia for giving me the opportunity to present my work in this meeting. And before I begin, I would like to first acknowledge the First Nations people of Australia and their knowledge systems and pay my respects to the elders present, past, and emerging. So the theme for today is data science for social good. So I will talk a bit about my background and some projects that I work on that has prioritized different elements of meaningful engagement with communities for data-driven research that eventually informs policy. So these are my contact details. So I'm a health informatics specialist for APRISE CRE, which is the Australian Partnership for Preparedness Research on Infectious Disease Emergencies. It's a Centre for Research Excellence funded by the National Health and Medical Research Council here in Australia. It's an Australia-wide network of experts involved in medical, scientific, public health, and ethics research. Many of these experts are based at the Peter Doherty Institute for Infection and Immunity here in Melbourne, Australia. My second role is that of a research data specialist for Melbourne Data Analytics Platform, which is a multidisciplinary group of data specialists who collaborate with researchers across various disciplines to enable data-intensive research. I also have an honorary appointment with the Royal Melbourne Hospital here in Melbourne. So I did my undergraduate and postgraduate studies in bioinformatics and computer science. And since 2018, I have been working in the niche area of health data science and health data analytics with a particular focus on infectious diseases. Although my core skill set is computer science, I contribute to projects in different ways. And I call it building data bridges for evidence. So I harmonize data fields and definitions for projects. I explore minimum information models, particularly to bring together data sets from different systems that look very different. Also work on data linkage across different clinical units, departments, explore data models for care, consent model, data analysis, also develop data sharing agreements, data access protocol, governance framework. And more recently, I have started exploring bioethics research methods and basically empirical research. I'll talk a bit about that case study shortly. So there are three things that I'd like to cover, briefly touching upon public engagement in health data, some case studies, so the projects that I work on, and lessons learned. So public engagement for health data-driven policy. So this is a paper that I found quite interesting that came out this year that describes community engagement, particularly in the context of public health. So community engagement has been regarded as a critical element of successful health programs to achieve health for all goals. Numerous studies have shown that it plays a significant role in reducing inequalities, improving social justice, enhancing benefits, and sharing responsibility towards public health. Large-scale studies are, however, needed to systematically identify current status, hotspots, knowledge structure, dynamic trends, and future developments in this field. In the context of the pandemic, it has truly revealed across the world how fragile the health systems are. And there is a clear need to be more inclusive towards the communities and include everyone in all stages of health response, which is planning, governance, design, and delivery of health service to improve overall health and well-being of people, not just during a pandemic, but also when we are in, say, peacetime and not battling a crisis. And Lorina's presentation captured the fundamental principles of this concept, and particularly the connection between policy, people behavior, health outcome, data collection, and accuracy that underpins everything. So I will not go into further details because Lorina has said everything that I would have liked to say. So I'll talk a bit about the case studies and the projects that I'm working on. So I briefly touched upon that I'm working on a bioethics research protocol, which is basically benchmarking public attitudes towards secondary use of health data. So health data is captured in two different formats. So there's structured data, which is fields, and then there's codes associated with structured data, and unstructured free text, which is basically clinical notes that the clinician enters about a patient's health and well-being. And they're captured in electronic medical record systems. It is straightforward to de-identify or anonymize structured data, but it's not easy to de-identify or anonymize unstructured data in clinical notes because it doesn't follow a particular, I said it's unstructured, it doesn't follow a structure. So it is tricky to go and look at every sentence and potentially remove all identifiers. However, natural language processing as a method for analysis of unstructured data is emerging. So NLP is a processing mechanism whereby computers can understand human text and speech terms. So we're working on a bioethics research protocol to engage with members of the public to assess their acceptability of processing their clinical free text with a particular focus on NLP. So we did explore other digital methods before finding one method that we found most appropriate. So some of the methods we explored were focus group meetings, and we explored the pros and cons. Focus group meetings, bias can be controlled to some extent. In-person meetings are not accessible for all, and engagement can be low on a platform, particularly for introverts. We then looked at news, social media, and other publicly available data to understand public attitudes. For example, processing tweets, which has a low cost for implementation, uses publicly available data, but it is difficult to measure acceptability levels, and it can be biased depending on what kind of people use a particular platform. We then looked at semi-structured interviews where accessibility is great, bias can be controlled to some extent, but it can be a bit time consuming. And again, it's a little bit difficult to put a number there to measure acceptability levels. So we then decided to go for surveys with Likert scale style questions where it is quite accessible to people. It can be done online. Bias can be controlled to some extent when we're trying to find certain demographics of people responding to surveys. And we're also able to measure acceptability levels. However, there are some cons to it. It can be expensive to implement, and it needs a bit of incentivization. So this is a work in progress. We're still trying to improve how we can make it a little bit more cheaper to implement, basically. So in our survey, what did we ask people? So we had three main modules. The first module focused on the de-identification of the free text data, as well as the coded structured data by a doctor, a research assistant, and a computer. So we had a scale from 1 to 5, and we asked people how comfortable do they feel with a computer, doctor, or a research assistant de-identifying their structured, their coded data and free text data. And then we also asked the factors that influence the respondents' feelings towards processing, the process of de-identifying. Then we asked people about the organizations that will be processing free text data and coded data. And we had similar Likert scale style question and free text responses. And then we asked people about the secondary purposes for processing their free text and coded data. We had a scale, and we also had free text responses. We also asked people demographic questions, which is something I should have mentioned. So we asked people about their age, their gender, and their economic status, their health status, education, and et cetera. So we distributed this survey amongst our colleagues just to collect some test data to see what happens. So for example, this is a question where we asked people how they feel about their coded data and free text data being anonymized in different settings. So at a general practice and outside a general practice, basically at a university or another setting. And on a scale of 1 to 5, they were asked to rank their comfort levels. So here we can see that the most popular choice has emerged to be somewhat comfortable, mainly, and the levels of comfort reduces as more and more people who are disconnected from the process get involved. That's how I would interpret this. So anonymizing coded data at general practice, which is a relatively straightforward process, seemed to be something that people were most people were comfortable with. And then as you go to the next level, coded data outside general practice is something that people were not very comfortable with. Free text at general practice seemed to be all right, just about the same level as coded data outside. But anonymizing free text outside general practice seemed to be the least popular choice. And not many people seemed comfortable with it. So we also looked at some free text responses, and we used off-the-shelf natural language processing tools that Python has. And we looked at lemmas, so basically bringing words together that mean the same thing. So we were looking at free text responses where people responded with words like comfortable, commercial, data, government, health, research, trust, work. So that was quite interesting to see. And these are the most common 10 lemma at the bottom left, where people use these words in their free text responses. We also did some sentiment analysis where we looked at how negative or positive people's sentiments were towards the questions that we asked. And here you can see sentiment score or binning, basically, where two terms that were used in conjunction are mapped together in this visualization. So what are we trying to measure here? So the next step is for us to see how the responses that we collect adapt to the theoretical framework of acceptability, which is used in clinical interventions. So we've adapted it to our research, and we're looking at a multifaceted construct that reflects the extent to which people consenting to the use of their de-identified health data consider it to be appropriate based on cognitive and emotional responses towards process of de-identification and the secondary purposes for which the data will be processed. And these are some of the elements that we're trying to measure or assess. So there's the ethicality, affective attitude, burden, value and benefits, perceived effectiveness, and coherence. I wouldn't go into too much details into every aspect, but I think the best way to summarize it is we're trying to measure the perceived amount or the perceived response towards all these elements, which is then mapped to the secondary use of processing their de-identified data. My second case study is building a clinical data repository through dynamic consent model. So currently, there is no single platform that enables research access to hospital data on patients managed for COVID-19, nor a process to access these data. There's different kinds of data sets sitting within the organization. So there's clinical unit specific data where there's emergency data, ICU data, and other clinical units. Research repositories that are held within the hospital. Electronic medical record, business intelligence that does reporting and analysis of routine data that's being generated in the hospital, and microbiology that looks at pathology and other kinds of data. So what we're trying to do is we're trying to build a repository, and our partner in this project is BioGrid that operates a federated national data linkage platform on behalf of its member collaborators that are health services, universities, and research institutes that utilize this trusted virtual real-time data linkage platform to conduct collaborative multi-site research. So we're trying to do data linkage. We're ethically trying to link and integrate hospital-based data through BioGrid's federated data sharing platform through their collaboration agreement. BioGrid also manages data governance by managing researcher access to multiple data sets, subject to data custodian and ethical approval required for each specific research project. So we're trying something like a dynamic consent model here. So we ask people for permission to ask permission in the future, basically. So we ask people if they're happy to be a part of this repository, and the participants were recruited on the basis that they will be sent research proposals for review. So they can pick and choose which project they want to be involved in. We had a really good success rate. We contacted 700 people through electronic means. We used RedCap, and about 150 out of 700 people said yes. The third case study is exploring HIV data models in Indonesia. So we're looking at models of data collection that informs cascade of care. So the HIV treatment cascade is a model that outlines steps of care that people living with HIV go through from initial diagnosis to achieving viral suppression, and shows the proportion of individuals living with HIV who are engaged at each step. So we're trying to identify the data collection mechanisms and sharing processes between community-driven and government organizations. Within Indonesia, there are different levels of public health surveillance, monitoring, and evaluation, and different kinds of data collection, different kinds of entities that are all part of this ecosystem that forms HIV surveillance. So this is something that we're trying to explore, how data underpins all of this, and what are the mechanisms through which the data is collected. We're then trying to identify the collection methods, instruments, reporting processes even, and data sharing practices. The question here is, how does data identify key indicators in HIV monitoring, evaluation, and care? And how are those indicators identified? Is there enough data that's being collected on those indicators? And what happens in the cascade of care once those indicators are collected? The fourth case study is a bit focused on health, but can be applied to other domains as well. So this is supporting Indigenous governance of Indigenous data. So for this project, we've worked with the Kyella Institute in Goulburn Murray region here in Victoria, Australia. This institute and its precursor organizations have pursued the goal of self-determination for more than 3 decades for Aboriginal people living in the region. So we've worked together to take a big step towards creation of an Aboriginal data governance framework and associated policies, mainly to drive Aboriginal self-determination, which enables people, communities, to take charge of their own future and strategies to achieve parity in terms of health, economic, social, and justice outcomes, which allows Aboriginal people and communities to set their own measures of parity and prosperity, tracking progress towards them, and track progress towards them, and influence policies that directly affect them. So how did we do that? So we found the right set of guiding principles like OCAP, which is First Nations principles of ownership, control, access, and possession. CARE principles, which is collective benefit, authority to control, responsibility, and ethics. All this in consultation with Indigenous researchers or First Nations researchers living in the region. And we also looked at culturally appropriate frameworks to develop resources. We're exploring something called a two-way governance model that balances Indigenous community needs to address community cultural protocol, as well as corporate and data governance protocol that complies with organizations external to the communities and the region. So we're at a stage where we're now scoping information platforms, basically data management platforms that are quite metadata rich, which will manage data in line with these principles and the frameworks that we have developed. I should thank all my collaborators because I've learned so much from them, and through them, I'm exposed to other domains that are outside of what I have studied or I've been trained in, and I'm able to access these wonderful, knowledgeable people and their knowledge as well, and then work on different projects. So big thanks to everyone. So to quickly summarize my talk, why do we need to actively consider the social bridges with community? Because health issues are a multidisciplinary issue. It's not restricted just to health. It is connected to employment, education, social living, the living status, conditions, housing, and everything. There is diversity in the information ecosystem. One source of information cannot exist as a silo and then not interact with the other source of information. Engagement, and I would say meaningful engagement with communities at every level, enables timeliness, completeness, and accuracy of data, because it has local as well as international implications, and the pandemic has rightly highlighted so. We need to drive meaningful dialogue between communities and practitioners, particularly in the context of health and health data-driven policies. There are small steps that people can take, and that's the little steps that we're taking, and that's what I attempted to present through my case studies. There is a clear need for a knowledge base and active contributors. Data needs to be used and reused ethically. So we have learned that partnerships between researchers, communities, and government is really important. And the most important thing is to identify what are the priorities of the community. Transparency is really important. That leads to trust, because there needs to be transparency in the process of collecting, using, sharing, analyzing, and storing data in order to build trust. There's human elements of tools and technologies. So implementing new systems, new analytical methods. It's not always about the data science. It's about understanding how do communities and people feel about new tools and technologies. And social indicators of health, every epidemiologist knows that. Why do some people experience a higher burden of disease? Do we know enough? Are we collecting the right amount of data? And are we collecting the right data in the right way? Thank you so much for having me. And these are my contact details. Like I said, I'm on Twitter. Please feel free to follow me. And yes, thank you so much for the opportunity.
It is us. So thank you for this very interesting and dynamic presentation. And now I'd like to call Lorena and Eduardo so that we can all jointly discuss and you can answer the public questions. And it was very interesting overall, summing up what I heard today, because Irina emphasized the UNESCO recommendations that were just voted this week, okay, as an official recommendation for data sharing for the public good. And both you and Lorena emphasize community engagement, the importance this has, as well as different methodologies for collecting data, processing data, and extracting information for the social good. So now I'd like to ask Eduardo to help us with questions from the public.
Well, we have 2 questions for each and 1 question for both, okay? So maybe I can just read them, all of them, and then you, because if you have all the questions, you may even engage between you, among you with questions that you have. Well, for Lorena, you emphasize the effect different policies have on testing frequency associated with socio-economic data. This shows the need for quality data collection and collaboration between social scientists and data scientists to correctly process and interpret data science. Can you comment on this, please? And the second question is, most social science research involves ethical concerns, up to this point based mainly on, well, several procedures which are listed here, but mainly on authorization terms signed by the subjects. How to face these same ethical problems while researching themes that are so common in the social world, which are illegal, socially rejected, involve socially rejected behavior and hidden informality that the subject does not want to be revealed. Okay? For Priyanka, your work also includes finding the best data collection methods to obtain meaningful and ethically accessible processing. Does this vary according to respondent profile? For example, indigenous populations might not react the same way with non-indigenous populations, and I would add among indigenous populations, depending on who these people are, who these people belong to. And the second question is, how can you help eliminate data bias during data collection or social behavior, on social behavior to allow appropriate analysis? Okay. And the question for both is, data science is becoming increasingly important in supporting public policies, as you both mentioned. This requires, as you both showed, public engagement, but also lots of effort on training on the part of all researchers involved, as well as government officials. How can we create a culture for data collection and processing, both within the public sector and in society, that helps this whole project to evolve? That's it.
So maybe I can start, and then Priyanka, we can try to complement each other. Yes. So I think these are great questions. I think the issue that we're seeing, and this has, in terms of speaking specifically around testing, and if we compare what the quality is of data that we have about testing across countries and in Brazil, there's a lot of difficulties that we have in terms of comparing across countries, comparing across cities, comparing what are we comparing and what type of data we have. And it starts with the fact that we need to even think about, every time that we say so many tests were undertaken, we need to know, are those tests on the same people? Are those tests on different people? And how often are people being tested across time, for example? But in most countries and in many places in Brazil, I would say we don't have yet a case where we have that high quality of data. We're using data just on overall testing, not knowing enough at a granular level in the public data that we have to actually know what's happening. And so what happens? We as researchers, we are filing complaints through open access information, requesting data, trying to get access to better quality data, anonymized, because we don't need to know the individuals who got tested, but we do definitely need to have more information about the quality and the coverage of data. The challenge that we have is that in most cases we've been unsuccessful. And we don't have the specificity that we would like to have. We also have a huge challenge that we have private and public data that needs to be unified, and we need to think creatively about how do we do that when there's different systems that are created to track cases in the public health system and in the private health system. So I think that those are some major challenges that make it very difficult for us to really make inroads on using testing data effectively in Brazil. The second issue around
maybe if I may interrupt, maybe just, I don't know if Priyanka would like to. I interrupt people all the time, okay? So I just wondered if Priyanka
go ahead, Claudia. It's
would
okay.
like to make this effectively dynamic. So Priyanka, would you like to compliment? I'm just asking you, but so feel free to interrupt everyone, as I do.
No worries. Thank you so much for that. And I think the only thing I would add to everything that Lorena said is that I see interdisciplinary research and people collaborating being the key here, because I think half the things that I know today, I wouldn't have known if I wouldn't have worked with social scientists, because I'm a technology health data specialist, right? I don't know anything about social science. I don't know anything about ethics outside of the processes that we do. I don't know what bioethics would look like. I don't know what community engagement would look like. So I think everything that you've said, Lorena, I would say transdisciplinary research, interdisciplinary research, and top-down support for that. So building those kind of platforms and capabilities where different kinds of researchers are able to talk to each other and communicate with policy makers and show them the value of applying different lenses to their research. I think that's really important. And that would answer the question that has been asked to me as well, like how to eliminate bias. Talk to a statistician, talk to someone who understands communities really well, understand how to include people into a study so the study feels more inclusive and is fair basically towards everyone.
We also need to work with the population to know, like, why are people seeking testing? When are they seeking testing? How do they view testing? How do they understand testing outcome indicators? Because we need to be constantly contrasting outcomes of what we observe with also how governments are enacting policies, but also how citizens engage and use that data to change their behavior. And if we don't monitor and combined research to enter on all fronts.
No worries. So in order to not break the thread, I'll address a completely different question that was directed at me, which was referring to working with indigenous communities and indigenous populations. So I would like to preface that by saying that I did training in order to understand how to do research with indigenous communities rather than on indigenous communities, which is a very detached way of looking at people and is a very technical way of looking at it. So particular training in health, understanding how to work with indigenous communities, mainly for health research. So that training really helped because the language is really important. How you communicate with people is really important. You need to be respectful, understand that there is a history, there is a past, there will be mistrust because the system has failed people and has failed to do justice. So acknowledging all of that. I would also add that not seeing all indigenous peoples and communities as one homogeneous community is really important. because that is a mistake that a lot of people feel, that if one indigenous community has said yes to one type of research, all other communities should agree to that. That's just not how it works. The most important thing is to listen, is to understand that there is different kinds of emotions associated with health research. There's particular weight, and there is a lot of implications that it can have on policy. And understand that your lived experience as a non-Indigenous person is very different from the Indigenous person's lived experience. So I think listening and making sure that your engagement is respectful, and also acknowledging that mistakes will happen. And if mistakes happen, that doesn't mean that you walk away from a difficult project. It's important to understand, talking to the community members, what kind of data would they like to be collected? What is the health priority for them? What kind of research questions do they have? And what would they like to investigate if they have full control over their data, the research questions, the analysis findings? There'll be a very different set of dialogue happening if that's how the communication happens. And also taking a strength-based approach, which is something that I've learned from other Indigenous scholars who have written books and papers about this, that not looking only at the weaknesses, which is what a lot of research, health researchers particularly focus on, but understand that there are community practices and age-old traditions and the science in the Indigenous communities that actually lead to the strength-based approaches within the community. So acknowledging that and incorporating that into the research as well.
Thank you. Lorena is back. So I'm sorry, Lorena, continue or from where you were.
So I'm not sure where I got cut off, but I was just trying to underscore that.
So just a second, I think you have to repeat what you said because we couldn't hear it.
Okay, so I was just saying that I wanted to really underscore that when we think about testing, we also have to think about how communities are engaged and how communities understand testing, how they seek testing, the access they have to testing, how indicators and how the information about testing is being used in communities is very important. And we're seeing that across the pandemic is that we really need to mobilize society to get tested, to demand testing, to demand access to information about testing. It makes a huge response in communities to protect themselves when we know what the level of risk really is in those communities. But we also need to ensure equity, and that means knowing if vulnerable populations have the same access to testing as more wealthy populations or more privileged populations, for example. And so there's a lot of work that needs to be done in these issues to think about integrating policy dimensions. So who can be tested by policy? How does the community adhere, or what's their engagement, and how do they use testing information to change their behavior? And then thinking about that, how we can use that to combine with assessing. All of those things together, we have a much better understanding of what's happening on the ground.
Yes. So, and now, I don't know, Eduardo, if both Priyanka and Lorena already answered the questions because I did not keep track of them, or if Priyanka and Lorena, yeah.
Yes, the second question was around illegal. What do we do when we're trying to monitor something that's illegal or that's, and I think it applies equally to controversial or polarized information, which we're seeing a lot with vaccines, of misinformation and false information. So how was we as researchers, part of what I was trying to allude to when I shared information about Twitter and about the monitoring that we're undertaking around Twitter is it's incredibly important for researchers to have access and to be able to monitor what is happening with citizen behavior, respecting privacy, but also understanding that there's a lot of information that is being disseminated that has important consequences for society, and we need to be understanding what are trends, what are some issues that are arising and circulating in those outlets. So I think there's a trade-off that we need to recognize around how much monitoring we want to make of citizens, and that includes how much do we follow them. For example, when we think about tracking cell phone activity, or we think about looking at information that you can get about users and how they interact on social media. There's specific privacy issues that we need to discuss, but we also need to think about the larger social implications of how individuals are using those outlets to spread information that has disastrous consequences for the response to COVID, and it can have disastrous personal health consequences for individuals who follow, for example, advice that is not that's not scientifically valid or it's not correct. So we need to be thinking very carefully about these issues and having a much bigger discussion. COVID was an amount of where we did a lot of creativity and we used a lot of data differently for many things. Social media, cell phones. Now we I think we need to step back and have a more fundamental discussion in Brazil and in the world around what are some of the trade-offs, what are some of the lessons learned, what are some of the problems with what occurred during the pandemic, that we need to think about how to better kind of sustain that we protect individuals, we protect communities, but we also allow that the data that we are collecting can be used more effectively to guide a better response to an emergency. But I think that it's very difficult with illegal activity because the more we monitor illegal activity, the more it finds another place to hide, right? And we need to be aware of that. So there's a trade-off, but I think we have an urgent need to be monitoring this activity, and to us as researchers showing to society the value of monitoring and what we're learning.
Yeah, if I may add something about this, I think there are elements which are associated with really monitoring illegal activities, but also trying to understand the ethical problems associated with answering things to persons who do not want to be cited, or the risk of citing. Actually, it's not that, because you can also guarantee that the person will not be cited. The problem is finding interviewees in themes in which the risk of being cited, or the risk of someone knowing that you gave the interview even is very high. So the more reasonable behavior is to reject. So there are fields in the social sciences in which it will be really difficult to go forward with this trade-off. Between protecting both because it's protecting the population, which is being interviewed, but also protecting the research from getting information which is highly biased. But on the other side, you can proceed in these fields only by asking people to give interviews and follow their behavior in ethnographical work without any kind of control, because the control will just make the interviewee disappear, and so it's really a difficult trade-off.
And I think the issue, the last thing I just want to say is, and there is a difference of public officials and government employees, right? So when public officials and government employees, when we're studying them, I think that there's a really different metric of transparency and privacy that we also have to have a conversation. But I think there's accountability issues that are very different for private citizens and those who are holding government office, and while holding government office are undertaking or circulating false information, for example, or undertaking illegal activity. And we as researchers want to alert society and alert public officials about the activity that we detect. And I think that this is very different from talking about private citizens. But with public officials, I think different rules apply and different standards apply.
Priyanka.
I had a question for Lorena. You raised a really important point about misinformation. And I recently read a paper about the platform TikTok and how much of a not a controversy, but there's a lot of issues that the platform, not the platform in itself, but it is valid across all social media, right? There's good information. I'm a researcher on Twitter. I try and share factual things. And then there is misinformation that is also shared on the same platform. So I'm seeing a huge responsibility for the platform owners to be more proactive in tackling misinformation. So they add labels, they add banners, but it's still not gone. So what do you think researchers can do in this space?
I think it's a really important conversation, and I'm very worried about it. I want to underscore something that we've been having a lot of discussions about is I think we became really aware of these issues in the US context in English language. But the monitoring of social media, as we think about the multiplicity of cultures and languages, the challenges of monitoring and thinking about social media and how we detect or how we can study and use social media to detect and study specific problems like misinformation, we may face tremendous challenges first because of language and cultural issues. Metrics or methods that are used to detect or detect sentiments in English are fundamentally and radically different in other languages. And we have to do kind of a lot of really careful work first to curate and develop correct kind of ways of looking and understanding and studying social media that are specific to culture and specific to the language and the community. And I think we're not as aware as misinformation that's being circulated in the developing world because it's very difficult to undertake research in contexts beyond English. And we still don't ask as much as we should about what are some of the risks involved. I can say that specifically in the case of Brazil, where we're seeing some of those challenges. And I think what Priyanka, you're raising is that also as researchers, we don't have information or access to information on all of the platforms in the same way. Twitter, by far, the reason we study Twitter is because it's one of the only platforms that we have access to really retrieve information and track information. And a lot of the other social media, it's very difficult to actually, as a researcher, for you to gain access and collect the data and to be able to have the type of data to undertake a systematic analysis of what's going on. And so I think we have to also have a conversation as researchers to think about. We learned a lot about how social media could be an ally, but also how social media has been an important player of polarization in recent years. And with respect to COVID, we've seen that as well. I can't tell you how many times I log on to Twitter, and the first feeds I get are tweets about from people who are anti-vax. And clearly, I'm not posting anti-vax information, but that's the information that's being sent to me to react to, because that's how social media is also trying to see what you react to. And so I think we need to be spending a lot more time demanding transparency about algorithms, what information is being sent to which users, how it's being sent. When you want to report a tweet or you want to report an alert, what type of information do we have about what's being reported over time and who's reporting? And access to data. We need to really have a conversation. We don't have equal access to data across countries and across cultures, across languages, also across types of social media outlets. And I would be curious, Priyanka, for you to tell me what's your experience on those issues, since I raised the culture and language issues.
And if I may complement, okay, because what is really fascinating about this whole debate is that Lorena and Eduardo are social scientists who are computing savvy, okay? And Priyanka is a computer scientist who is socially savvy, let us say. So this makes you sensitive, right, to distinct kinds of issues that many computer scientists are not trained for, and vice versa. Okay, so just complementing on an observation about this interaction that we are looking for at FAPESP and the eScience and data science program, about how to increase the interaction and collaboration between these, it's not worlds, okay, but scientific cultures. So sorry to add another dimension to the question. Thank you.
Thank you, Claudia. And that's one of the nicest things I've heard, that I'm sensitive. That's really kind of you to say that. Lorena, I think there's multiple layers to the question that you asked. So I'll just talk about the language part. I'm a multilingual person, but everything that I access is mainly in English. So I don't have a lot of understanding on how information is digested and shared in other languages, which I'm kind of feeling a little bit bad about, because I speak 4 other languages, but I don't consume content in any of those languages, even if I can read and write in those languages, which is interesting. I think because I live here in Australia, not in India, because that's where I'm originally from. The second part that Claudia raised as well, and you were talking about the algorithms, and I think there needs to be a very high level of transparency in what is happening, because interestingly, I have never seen an anti-vaxxer tweet. I have never seen any of that content, which is rather strange, because it's there. It's not like we have rallies going on here in Melbourne, so it's not like it's not there. That content is out there, but I wonder why I don't see it. Is it because I work at the institute here, which is at the forefront of pandemic response? Is it because I'm constantly tweeting about infectious diseases? I'm constantly tweeting about vaccines. My Instagram stories, my Facebook stories are full of pro-vaccine quotes. Is it because my algorithm has become biased towards me and everything that I'm consuming, everything that I stand for, that I don't see any of those tweets? Which is why I was living in a bit of a bubble, that I don't see anything. Where are these people coming from? And then I see on a Saturday, thousands of people are in the city marching, but I don't see them. But my social network is quite biased, because I moved to Australia to study, and all my friends are mainly at the university, started working at the university. Friends are at, all my friends are academics, which is, a strange way of living. Not my partner though. So he has a very diverse field, diverse range of friends, which kind of changes his social media content. But my content is very biased towards me as an academic and only shows me that kind of content. So I don't have access to any of this. So that's why I wonder how these algorithms, what data do these algorithms have access to, which is my question, that they're able to tailor my content so well based on my research experience and every social interaction that I have. And that's the scary part. How does it know me so well? And then health misinformation is spread like that through these platforms, because people will say things that do not have any scientific basis, and you'll get more and more and more. This is a vicious cycle that one follows. You access one piece of misinformation and all you get after that is misinformation.
And actually, to kind of complement Priyanka's perplexity, I have a similar perplexity. It has nothing to do with social networks, because I do not participate in social networks. But in spite of all anti-vax or vaxxers movements and Twitters and whatever, Brazil is having an enormous success as compared to many other countries in the vaccination rate, so much so that from what we hear, I don't know, 80% of the population has had 2 doses in some cities. 94% of all those above 12 in the city of São Paulo. Nevertheless, the vaxxers and anti-vaxxers exist. So, Lorena, how would you, and Eduardo, who know our reality, how would tweets influence?
I would say that this has several layers, maybe. In one layer, this is interesting to show how social behavior and expressed behavior are not necessarily connected or are not completely connected. And in the Brazilian case, I think the success, the present success of the fight against the virus has to do with a certain disconnection between a part of the population who complains a lot, but goes to the health unit to be vaccinated, differently from the anti-vax in Europe or other places in which, or in the US, in which they do not get vaccinated really. And today in the morning I was thinking about because the governor of São Paulo is going to open the masks, suspend the masks in open spaces now in early December, and a lot of experts are saying this is too early. Although the infection rates are low, this is too early and should be at least 2 months more, especially because we are going to have Carnival, which has a lot of agglomerations in February and March. And I was thinking that a similar phenomena happens with the masks. People complain a lot about the mask, but everybody uses the masks on the streets. Maybe in bars, at the end of the day, you see a lot of people without masks, but in the streets, in the subway, on the buses, through the day, at least here in São Paulo, it's really intense, the use of masks. So that it's the same of cognitive mismatch between behavior and expressed behavior. What do you think, Lorena?
So I want to say, just a little bit, go back to my presentation. One thing that shocked us, but I think that I'm not surprised that we have high vaccination rates in 2021 because of the tweets that were analyzing the content of 2020. Before there was vaccines available, we even had news that a vaccine would be approved. 80% of the activity was overall positive in Twitter in Brazil on vaccines and supporting vaccines or seeking information about vaccines in a neutral manner, circulating studies, discussing what we're learning. There is a minority of information that was being circulated, and the data that I presented was looking at political elites, because it's who's running for office and what information they were circulating. And even among political elites, a small minority, 20% of candidates affiliated and aligned with President Bolsonaro are circulating information against or questioning the validity or in the need to have vaccines. And I think that it could have actually helped us to predict what would happen in Brazil, right? We didn't need to be worrying about so much about an anti-vax reaction in Brazil that is across the territory, but it's very localized. And that happens the same thing with the candidates. In fact, in the cities that we're monitoring, there's specific cities in which candidates were really vehement. And I think that we could be thinking about that is those are the places where we need to be thinking more proactively about where this could be happening. Like Eduardo was saying, mask mandates in general, there's a lot of adherence and people see the efficacy of the behavior. What we need to know and we need to understand is when in a community or in a certain ideological group there's opposition, why is there opposition? And if we can kind of geographically or for some other reason identify what are the issues, then we can have a debate around the evidence and communication and campaigns. But in order to do that, we need to have access to the data. We have that with Twitter. We don't have that on WhatsApp, for example. And so a lot of the information that was circulated around vaccines in WhatsApp groups, it's very difficult for us.
Claudia, você está dizendo?
Yes, I know I was muted, so I could listen, right? I'd like to, this is all about future directions as well, right? This is why we have this webinar, and that I'm so grateful to both of you and also Eduardo for contributing to this very fruitful discussion. So we still have 8 minutes. Could you both comment, starting with Priyanka, on how data science for social good, what are future directions or promising directions, not so much in research questions, which is also a problem, but should we train people? Should we engage the community? Should we convince the government on the worth of these new technologies to improve decision-making?
Thanks, Claudia, and that's a really interesting question. Lots of ideas, I think. I don't know how reasonable it is to implement everything that I have in my mind right now and everything that I've learned from other people as well. I think starting right from the training aspect, not just researchers, but everyone. I think multidisciplinary training is really, really, really important, particularly for computer scientists, because computer scientists can be very focused in the infrastructure, the codes, and everything else that's to do with data, but forget the human element sometimes. And I think that social science training and being sensitive towards understanding that this is human data that we're dealing with, in case of human data, really, unless we're working on biodiversity and other kinds of projects. So those training modules should be incorporated in the formal training. So if you are training in machine learning, you're training in data science, a little bit of ethical engagement with communities that has to be plugged in. It can't be separated. It has to go hand in hand. I don't know to what extent this is realistic, but this is something that we're doing at our university, where we encourage multidisciplinary projects and we have people from different disciplines work on them together. So I, for example, work with someone who has a background in music and digital ethics or law, or someone who has done lots of genomics, bioinformatics, and we all get together and then we work on projects together. So we bring different expertise together. And it's a little bit humbling when you have people who have different expertise, so you know how much you don't know. That's the most important part, because that makes you learn more. So that's really important. So universities could incentivize it, government could incentivize this, get different kinds of people to work together. Formal protocols are really important, I think, for formal protocols of engagement, formal protocols of including people like dynamic consent, ethics, and how do you actually maintain transparency in how people's data is being used, make the policies publicly available. What is being done with the data once it's collected? How long are you retaining it for? How do you destroy it? When do you destroy it? How is it repurposed? To what extent is it de-identified? Who has access to different levels of data? And what kind of ethical approvals do people need in order to access data? For example, we are transparent that we keep clinical data separate from that consent module where we call people, send emails, because those data sets cannot be combined, because the person who's recruiting these people into the research shouldn't have access to the clinical data. They should only have access to their contact details like email and other things. So that's one way of training people that, not all data needs to be combined. You need to protect people's privacy as well. So these kind of measures could be implemented. I think that's a bit of a wishful thinking, but if that happens, that'll be really good. And algorithms, I do feel, especially for public platforms, as Lorena said as well, tell us about your algorithm, tell us how your algorithm works. There needs to be some kind of transparency policies that holds these social media companies accountable, because they're feeding off our information. They're getting richer, they're growing their business. We need to know how they're doing it.
Lorena?
Yes, I think for me, COVID has been life-changing in terms of my career as a social scientist, because it's really, I've engaged and I'm working across, we always think we believe in multidisciplinary research, but when you have a major emergency and you're forced to kind of mobilize and go out there, and these incredible collaborations have been established as a result of this health emergency.
Your microphone, Lorena.
Okay, sorry. It's been has been changing in terms of fueling collaborations across disciplines and showing the promise. I think it's unprecedented what we've seen in Brazil of what we can accomplish together, and what we've done during COVID is incredible. It's really dramatic, and we really need to think about underscoring the incredible accomplishments that are taking place because we're working in multidisciplinary teams. I think we're working faster, we're asking new questions, and I think that one of the big challenges we have is in a lot of social science research in Brazil, for example, we need to think more about for example, much of the metrics of how we secure ethical approval for human subject studies is very different in the health sciences and in the social sciences. And I think we need to streamline and to kind of think through some of these procedures, because one thing is ex ante, the ethical approval you require before you undertake a study. And then ex post, I think that one of the things that we have in the social sciences that we help the health sciences is we have a lot of work and we've made a lot of efforts about replicability of our research and sharing code ex post about how you can replicate my analyses. And so I think there's definitely complements that we can take, but we need to be thinking more about implementing some protocols on both sides, ex ante and ex post.
Thank you so much. And I'm afraid we have to finish right now. I'm very curious about the BioGrid initiative, so I'll email Priyanka afterwards, but I'd like to thank all who are listening to us, and all who are going to watch the video. And I'd also like to thank FAPESP staff, Marcelo Melete, Gabriela Schmidt, Roberta Salles, and Vera Sirin, who are supporting us in this webinar. And Eduardo, for your final thoughts.
Just also thanking FAPESP staff, the audience who stayed with us this 2 hours, and especially Priyanka and Lorena, and also Claudia for the partnership. And I think it was a really insightful seminar. Thanks a lot.
Okay, so now we'll just close our cameras and microphones, and thank you, and see you soon again.